Have you ever wondered why we say avoid things in pregnancy, like unpasteurized milk or cheeses, soft cheeses, deli meats, hot dogs, uncooked hot dogs? It's because of listeria. And we're actually going through one of the biggest outbreaks of listeria since 2011, so over 10 years. Now, stay tuned in this episode. We're going to talk about why it's so important and ways that we can potentially still enjoy some of these options. Welcome back. This is the New School OBGYN, new series called Updates in Women's Health. It matters where you get your information here at the New School OBGYN. And so with that being said, my name is Eric Schmidt. I'm a board certified OBGYN, and today we're talking about listeria and why it's so important. And it's actually a pretty bad bug when it comes to pregnancy. So a quick background on the bacteria that called listeria that can cause listeriosis. Now, it is a foodborne illness that we get from eating certain things. Now, this generally doesn't infect a lot of healthy adults, but certain people with decreased immune systems, whether it's the elderly, the very young, or potentially people with taking steroids or other immune disorders. But in pregnancy also, the immune system is decreased. And you might have heard me say that in the past, especially women in their third trimester have a higher chance of developing listeriosis. And so in most adults, this doesn't cause an issue whatsoever. However, in pregnant women, we do want to be more careful because look at this table. Now, this is a table that actually shows acquired foodborne illnesses within the United States here, okay? You have a lot of the different bacterias located here on the left, and some of the more ones you hear commonly, Salmonella, Streptococcus, you have your other E. coli's there, and you look down here at Listeria. Again, not very common, only 1,500 number of cases per year, mostly foodborne, and hospitalization rate. Look at this, 94%. You look at a lot of these other bacterias, and it is very low. And death rate percentage, 15.9%. Again, it's very rare that it causes these severe diseases or listeriosis, but in that susceptible population, it can have some quite dire consequences and need a lot of medical attention. Let's review the most likely sources of that listeria again. We mentioned a few of them in the intro, but again here, let's look at this table. You might have heard you can't eat hot dogs when you're pregnant. Well, that's not really true, right? They don't want any of these meats here, like hot dogs, lunch meats, cold cuts, any of this deli style meats without being heated up. And so spoiler, but you can have these things as long as it is heated up properly. We talk about raw or unpasteurized milk. You talk about soft cheeses, and specifically with unpasteurized milk. Now, this would be a lot of the queso frescos that caused an outbreak not too long ago. Those are the Mexican soft cheeses. And then also, again, the smoked seafoods, it's not cooked to a high enough temperature to get rid of a lot of these bacteria. We've seen some outbreaks with the store-made salads, and then unwashed fruits and vegetables. So yeah, you can go through this list here, but again, just as long as we're taking these precautions, the chances of getting listeria in pregnancy would be even lower than it already is. All right, so what are the symptoms of listeriosis or getting listeria? So if by chance you have that gastroenteritis or GI upset, along with fevers, myalgias, other things like that, you're gonna wanna talk to your provider right away. And also, if the infection were to get into the bloodstream, it could cause other potential side effects. So if you're getting that GI upset, fever, and other things, you really need to get in touch with your provider. Again, back to pregnancy. Pregnant women have about a 10 to 13-fold higher risk of getting listeriosis. And the bacteria, unfortunately, has an affinity or really likes to go to the placenta and the fetal tissue. And so it can potentially have some pretty dire consequences. Things that have been studied show increased rates of preterm birth, increased risk of miscarriage, increased risk of stillbirth. And so some very serious things that this bacteria can cause if it's left untreated in pregnancy. So let's go through our frequently asked questions when it comes to listeria. How to reduce your chances. Now, as we talked about before, you want to avoid the unpasteurized milks and cheeses, as they have a higher chance of not getting up to temperature to kill these type of bacteria. Can you have hot dogs or deli meats when you're pregnant because you might have been told you can't? Actually, you can. If you have a certain craving for them, you can heat them up in the microwave to a temperature of 165 where they're really hot and steaming, and you can enjoy these meats because that temperature can kill this bacteria. You also want to pay attention to news from the FDA or CDC regarding outbreaks. Now, as we mentioned, we're currently going through an outbreak right now that is associated with boar head deli meats. So if you have that, you want to get and again, look at the websites to figure out, but you probably want to get rid of it. And you probably want to clean out the fridge if it's touched any part of your refrigerator. Often in my clinic, I get patients worried because they're letting me know, oh, I ate a deli sandwich and I didn't really realize it or wasn't thinking it through. Or that person maybe tried some cheeses or soft cheeses. They weren't sure whether or not they were pasteurized, and so what to do now? Well, we're going to monitor for symptoms. Now, if someone doesn't have any symptoms, GI upset, fevers, you likely don't need to do anything. Again, this disease is very rare. It has serious consequences, but it's very rare. So do keep that in mind. If you don't have symptoms, no further workup is needed. All right, this is one of our treatment algorithms when we're talking about Listeria. Now, the first question we ask ourselves, are they exposed? And so, for example, the most recent outbreak of exposure was with the Boarhead's deli meats. And so maybe somebody had some of those and they didn't heat it up properly and they want to know what they should do. Well, are you symptomatic? These would be things like GI upset or flu-like symptoms, myalgias, back pain, nausea, vomiting. Now, if somebody isn't, then we don't have to do anything. If somebody is, next question is somebody febrile or do they have a fever? No, we don't have to do anything. We could obtain some blood cultures just to make sure and be extra safe. The next question is, if that patient now has fevers, we're going to want to talk about treatment, and we'll talk about that here in a second. But first, I just want to make the point that some of these symptoms can come many weeks, potentially months after the exposure. And so we often say that if you experience any of these symptoms, the GI upset, the fevers, the myalgias that might come along, it could be up to 2 months after the exposure. So just keep that in mind. All right, lastly, let's talk a little bit more about the treatment options, because we do have treatment options, luckily. And so, but this is an antibiotic regimen. And so I'm not going to get into the specifics of it, but generally it's IV antibiotics if we have a really high suspicion that somebody was exposed or does have the listeriosis while they're pregnant. All right, lastly, take-home points. So we talked about how you avoid certain things like unpasteurized milk and cheeses. We talk about how you can have deli meats, you can have hot dogs, but you have to heat them up appropriately. And always wash the produce. Again, the other largest outbreak, it was 2011, it was from cantaloupes. So seems innocent, but you just want to make sure you wash those things. And remember, this all sounds very scary, but it's rare. But you can do all of these things and reduce your chances even more and still enjoy some of the things that you really like. So I hope you liked it. If by chance you haven't, like, subscribe. It really helps us out, keeps us motivated at the channel to continue to bring you content. And we look forward to continue to expand this Updates in Women's Health series so you stay informed and keep you and yourself and your baby safe.